This is Chris Casey, Managing Director at WindRock Wealth Management, a unique investment advisor with a focus on the macroeconomic big picture and an entrepreneurial mindset to seize on investment opportunities. Today, we have the honor of being joined by two unique entrepreneurs, Doctors Keith Smith and Steve Lantier of the Surgery Center of Oklahoma. Thank you both for being here today.
Thanks, Chris.
Thanks for having us.
Now, the Patient Protection and Affordable Care Act, commonly called Obamacare, this was enacted back in 2010 and took effect largely in 13 and 14, and it's clearly altered the healthcare industry. And I could cite, a number of studies that talk about how premiums have risen. I'm sure a lot of people out there have had the experience of having premiums rise substantially year over year. I think Bill Clinton did the best job of summing this up, and certainly not known as a free market advocate. He recently said, quote, "So you've got this crazy system where all of a sudden 25 million more people have health care, and then the people who are out there busting it, sometimes 60 hours a week, wind up with their premiums doubled and their coverage cut in half. It's the craziest thing in the world." And I would agree with Bill. But while the truth is, while Obamacare gets a lot of attention over the last couple of years, this healthcare industry has been broken for a long time, and it's obviously plagued by rising prices and the cost of healthcare treatment, but more importantly, it's the lack of transparency, the inability to even ascertain what those prices are. And I challenge anyone to ask their doctor how much any given procedure would be, because I really doubt they'll get an answer or an accurate one. They simply
Except us.
But except you guys, right? So tell us, in case people are not familiar, but at the Surgery Center of Oklahoma, you can even go to the website and immediately see, different prices for different procedures. Just, click over a body part. How do you guys come to to embrace this model where you are posting prices, these all-inclusive, transparent prices that anyone can go to throughout the country?
Well, Steve and I have always been fans of the free market, but the best way to view our posting prices historically, it's really a last act of defiance. The cartel of big hospitals and insurance companies had really done enough damage to us, really playing with people's deductibles and manipulating their out-of-pocket experience, so they really financially couldn't find their way through our doors and have that make any sense. So really seeing our case volume and our revenue drop kind of on the way down, we posted our prices kind of a last act of defiance, hoping that people who actually had the sticker shock, who actually were buying healthcare, would find us. And then some secondary goals we had was to start a price war and then hopefully better understand the scam of healthcare, because we knew we were cheaper and better, and our waiting room should be full. And so it was not a free market, that there were all kinds of obstacles in the way. So we put our prices online in that environment. And the most fascinating thing that happened really in the very beginning was that the Canadians were the first folks to show up, people who ironically, have coverage. They don't really have any access to the care many of them need.
Yeah, so in our almost 20-year history now, what Keith and I noticed, and again as anesthesiologists and not as businessmen, we saw that the insurance companies were punishing people for coming here. And again, as Keith said, we're cheaper and better, and we couldn't figure it out. So what we did about 8 years ago now, we decided to go on the offensive, and the way we did that is with price transparency and fair pricing. So on average, the Surgery Center of Oklahoma is 6 to 10 times cheaper than the alternative, the hospitals. And and we kind of view as a target, the insurance companies and the hospitals. Their methodology and just their whole model is evil, and it's been that way for a long time, and it transcends Republicans or Democrats. It's bureaucracy, and it's corporatism. So anyway, there's a lot more to tell, but that's kind of how we got into it. We were in a defensive posture and decided to take it offensively, and that's when we posted our prices online, and any one of your listeners can go to Surgery Center of Oklahoma, .com and look and see what our pricing is, and we're just as transparent as can be.
So you're far, far cheaper than a number of the competitors out there, the typical hospital or surgery center. Can you tell us the breadth of services that you offer?
Yeah, we do just about every type of outpatient surgery that a person could receive. Interestingly, though, on our website, we actually post inpatient surgery prices for facilities other than Surgery Center of Oklahoma because for one reason or another, they're not comfortable posting prices. So our website, it contains all-inclusive bundle pricing for everything that we do here, whether it's orthopedics, ear, nose, and throat, urology, gynecology, general surgery, but it also includes prices for procedures that are done at full-service hospitals that have desired to get into this space rather than fight what Steve and I believe is kind of the natural law that governs the free market.
Who have you found to be the primary patients that you've serviced? Is there any particular types of procedures or geographic area or patient profile in general? Who have you found availing themselves of your particular type of model with the full transparency and the lower prices?
I guess we had to look at a socioeconomic class. It would be the middle class who can't afford health care. But we get all comers. I mean, from the very wealthy to the poor. I mean, actually, there are people that otherwise couldn't afford surgery that look at our prices and go, well, I'm not very wealthy, but I can actually afford to have that surgery. And as you alluded to in your opening remarks, as the average deductible, goes up and climbs, over $6,000 now, our average price on our whole website, there's about 90% of the things that we do total. I mean, anesthesia, surgeon, facility charges, everything we consume during the surgery, those charges, I'd say 90% of them are under the normal $6,000 deductible that most people have nowadays.
The industry itself is remarkable in that the fact it is remarkable because there should be nothing in particularly unique about healthcare, right? Compared to any other industry at a fairly basic level, you have producers, you have consumers, you have prices, you have goods and services. And so at some level, healthcare should really be no different. But just like education, defense, finance, pharmaceuticals, it's plagued by terribly rising costs and deteriorating quality of service. And so, not surprisingly, all of these industries happen to have the greatest amount of government intervention. So let's just pretend for a moment that you had the power to take away some of these government interventions or in the marketplace for healthcare. What do you view as the most damaging and that should be eliminated?
Well, it's hard to know where to start. I mean, I'm reminded of that scene in Braveheart where he, spanked the guy on the rear end with his sword and told him to, leave and beg for forgiveness all the way out of the country, to every home that he encounters. That the federal government, almost every intervention, however intentioned, almost every single intervention that they engage in, not just in healthcare, is a choice remover because their ideas are so wonderful they have to be mandatory. But the Unaffordable Care Act, obviously in its entirety, is a disaster, and that part of the Unaffordable Care Act was a prohibition on physician entrepreneurs constructing facilities like ours. And that was a gift to the American Hospital Association to gain their support of this insane law. But you could keep going on back. I mean, the Republicans, after the defeat of Clinton's health care plan, enacted HIPAA, which was a huge part of Clinton's health care plan. So there's blood on hands on both sides of the aisle, and they need to just start repealing every single thing that they've done as far back as they possibly could stomach going.
Yeah, so instead of repeal and replace, we're thinking repeal and repeal and repeal.
Yeah, I've joked that repeal and replace is like giving gin instead of vodka to an alcoholic and expecting a different result.
Well, let's talk about a few of these interventions, and these go back quite some time. Like, for instance, what other industry? I mean, there's plenty of industries that have insurance that's involved. I mean, everyone has life insurance, homeowners insurance or renters insurance, and yet here we have insurance paying for pretty much every minor procedure or even hospital or I'm sorry, doctor's visits at this point in time. And that goes back, to probably the 50s, when the Internal Revenue Service started recognizing, the tax deductibility of healthcare premiums paid by companies. So that's one. If you had to rank some, you have that up there. You have monopoly bestowed upon the AMA as to the supply of doctors. Any others come to mind that perhaps directly affect you?
Yeah, HIPAA is a big one. There's also, the prohibition on physicians owning hospitals, but there's no similar prohibition of hospitals owning physicians. So hospitals will go, in spite of their poor mouthing, they go out into the community and to surrounding communities and overpay for primary care practices in order to secure referrals. And then they'll starve out the small rural hospital, and then they succumb to an offer they otherwise would have refused. And so there's this cartelization that's enabled by the PPO Act and the HMO laws that came out during the Nixon administration. Reagan gave us EMTALA, so that was a horrible intervention into healthcare. Then there is the insanity called the resource-based relative value scale. I call it the Rosemary's Baby of healthcare, birthed by Harvard, because they're so smart there. They knew exactly how much every surgery and admission in hospitals should cost. So the limit of government interventions we could discuss that have really distorted markets in healthcare. It goes way back. It goes all the way back to wage and price controls under Roosevelt, where in the high taxation, where companies got into the healthcare business so that they could compete for employees, giving higher wages as benefits. It's been a mess for a long time. There is a lot of blood on AMA's hands because there is a limit of players in the marketplace to provide care, and I think that's intentional.
And Chris, to that, I would add that the AMA in 1847 was maybe the beginning of the whole idea about nationalizing physicians. And so while there wasn't any legislation that really came down and put the federal government in place, I mean, that was the beginning, I think, of a really, really, really bad movement.
And let's keep kicking the AMA while they're down. Seriously, Steve and I don't think know a doctor who belongs to the AMA. 80% of the revenue comes from the federal government for the monopoly contract to print all of these insane coding books. And I honestly don't know, and I bet Steve doesn't know a doctor that actually even belongs to the AMA.
That is shocking. I had not heard of that. Another one that occurred to me, Keith, I think I heard you mention on an interview in a different forum, was about the certificate of need.
Yes.
For the construction of medical. Could you talk a little bit about that and how that's also reducing the quantity and quality of healthcare?
This is one of the things the federal government got right. The federal government was the beginning of this whole idea of certificate of need, and then they realized how insane it was, and so they got out. But several states kept these certificate of need laws, states whose healthcare industries were more cartelized for one reason or another than others. But I still think there are about 31 states that have these certificate of need laws on the books. And here's what it means. It means that if you want to build a surgery center of Georgia that follows the model of Surgery Center of Oklahoma, you have to make the case that there is a need for that facility in a community in front of a panel populated by typically hospital administrators with whom you would be competing. And so the approval slip that you get from those guys is typically not forthcoming. So a majority of the states still have these certificate of need laws on the books, and of course it just prevents the upstart, innovative competitors from entering the marketplace.
With that kind of law, I can't imagine any new startup. I'm surprised it happens at all. I mean, if look at something innocuous like the ice cream market. If someone wanted to open a new ice cream retail store that had a similar law for that industry, you would never have that open, especially when it's judged by its competitors. It's pretty shocking.
Well, and you'd have a predictable response in pricing and quality too.
Exactly. Keith, I know that you're involved quite a bit with founding the Free Market Medical Association. Can you tell us a little bit about that organization and kind of the purpose and strategy of what you guys do there?
Well, Jay Kempton and I started the Free Market Medical Association because we wanted the whole idea of the applicability of free markets in healthcare to spread. Excuse me, and it serves really as a kind of a Match.com for healthcare, where the buyers and sellers can find each other, and not present in the room are the typical intermediaries with their fog machines that render the transactions non-transparent. Everybody in the industry is involved. It's not just physicians, it's not just facilities, it's not just employers and buyers. These self-funded health plans love transparent pricing in what we're doing here. But there are also ERISA lawyers and stop-loss carriers and think tanks and just a whole host of interested parties that know that something's terribly wrong with healthcare, and I think they're coming to understand, the market is always at work. You're either in sync with it or not. And if you're not in sync with it, all you experience are its consequences. And so the Free Market Medical Association is teaching people who are otherwise unfamiliar with free market principles and economics, the basics, and it's also holding up as examples facilities that are embracing transparent pricing and free markets, and it's really a wonderful meeting to attend, because you have this feeling that everything's going right in healthcare when you're in that room, and all of the pessimism about the cartelized healthcare in the United States just doesn't seem like it has any place.
Well, another area that I've heard you mention, and Steve, maybe you could comment on this. Not only are you assisting people directly at the Surgery Center of Oklahoma as patients, not only are you out there advocating, some free market reforms that could help the industry certainly reduce costs and increase quality, but also I know that there's been situations where people have benefited at their traditional or typical local hospital from simply having met or encountered you guys and bringing your prices to them. Could you talk a little bit about that?
Well, sure. We encourage everyone that's not from town, if they want to use our website prices, they know that those prices exist. So if you need a cholecystectomy or whatever you need, to go ahead and to please use our price list and try to put some price pressures on the people in your area. And we've got story after story after story of that helping people get their pricing to a reasonable level. So we encourage that.
And how much have hospitals brought their prices down? Will they match it, or they simply have cut it in half, or what? How far have they gone to accommodating their patients in light of the patients bringing up your particular prices?
Well, it's not zero, Chris, but it's pretty darn close. They don't have to. Their paradigm is so different from ours. They make money off of overcharging, and their model is completely different. So they don't benefit from matching our prices. And while they feign to do that every once in a while, they haven't really done it at all. The pressure has not quite gotten to them yet. The free market pressures have not quite hurt them enough to where they're going to have to respond. So
Now, here in Oklahoma City, locally, we're beginning to see some cracks, though, in the foundation, a breaking of ranks. The hospitals seem to close arms and close ranks pretty tightly, but we're beginning to see some cracks and see that break down, where they're coming slowly to the conclusion that what's going on is unsustainable, and they're really putting their toe in the water to see if they can play in this space and like it. I don't think anybody that is in the big box hospital world is going to embrace this, though, until they have to. I mean, their model, their economic model is what can I get away with, and they're going to get away with all that they can as long as they can, and they won't change to a more value-based model until they absolutely have to.
Well, tell us if a patient wishes to get a hold of you, wishes to determine if you cover this procedure, how much it would be, and then just how they would arrange accommodations and how they would stay, for a few days in Oklahoma City after the treatment to recover, et cetera. What kind of arrangements and what's the best way for them to proceed?
Well, people can go to our website, surgerycenterok.com, and they can either contact us directly or they can search for the procedure that they think they need, and next to that procedure is a tab called Request Specialist. That generates an email directly to me, and at that point I try to connect them with the surgeon that I think is best for the job. If they are coming from out of town, we will give them a list of places to stay with associated pricing, all of which is discounted because the hotels want all this business. So there's usually a phone call from the surgeon where they talk directly about the patient's overall health status and their specific needs, about pricing if they want to talk about that. And then we make arrangements for how does the patient want to pay? Do they want to pay in cash or cashier's check or Bitcoin or bullion? We don't care. We've done all the above. So it's really very easy, and the website is designed to accommodate the layman and somebody who might otherwise be uncomfortable with the concept of medical travel.
What seems very easy to me, and certainly I'd encourage anyone to check it out. I mean, there's no harm or cost in doing so. At the very least, you can always bring this to your physician's attention for any planned procedures. If not, realize a sizable value discount in coming down to Oklahoma City directly. But gentlemen, I appreciate your time today. Thank you very much. And again, please, everyone should check out the Surgery Center of Oklahoma.
Thanks for having us.
Chris, thanks. Always fun.